Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy, a nutritional therapy counselor, and I am here with the one and only. A patient actually asked me this morning if you were famous, Dr. Jason Martin.
I'm pretty famous.
That's what I told her.
Yeah.
I said, in some circles, he's really famous.
Very famous. Just ask my parents.
That's right. It's selective. I did tell her that, it was situational.
It's situational.
You have situational fame.
So, Amy, what's our topic today?
Our topic is a really fun one because it's something that is brand new, and we were actually the very first people on Instagram to post about this last week. It is called AccuTite. It is a radio-frequency skin tightening technology, very similar to BodyTite and FaceTite that we've talked a lot about before, but it is very tiny and very mighty.
Yeah, so AccuTite. It's made by InMode. They're the manufacturers of BodyTite and FaceTite. It's the same kind of technology, but it's in a shrunken version. So you always talk about things being tiny or mighty, correct? So why don't we name some examples of things that are tiny and mighty?
Well, I think the best one is probably bacteria that we were talking about before.
Yeah, bacteria is pretty tiny and mighty.
Viruses, there is no better a cell. Mitochondria.
Right. You know what comes to my mind is Yoda in Attack of the Clones when he's fighting Count Dooku. Like, and he comes in with a cane and all of a sudden he just starts kicking ass.
Yeah.
That's
Tiny
and mighty.
Yeah.
Another thing I thought of was jockeys. So when I grew up in Kentucky, I would go to the racetrack to Churchill Downs, and the names like Pat Day and Calvin Borrell and all these people, they literally weigh 110 to 120 pounds, and they're riding 2-ton, 3-ton animals going some extraordinarily fast speed. They have to be super strong, so they're tiny and mighty.
I would say toddlers fit that as well.
Your pinky toe, you hit it every day and it never falls off.
That's true.
So
it's very mighty, but you'd miss it if it was gone.
You get the Borrowers. You remember those movies, the Rescuers? Every Disney movie from the 90s has something tiny but mighty in it. So that's what we're talking today about is AccuTite. AccuTite is an amazing technology. I'm probably more excited about this technology than I have been in almost any other thing we've gotten in a long time. And the reason is that AccuTite allows us to treat areas that we normally couldn't treat before. So as they say, as InMode says, it's precision targeting and proven performance. It really does open up a whole treasure chest of treatments that we did not have accessible to us before.
It really does. And I agree with you that this, more so than other things, gives a great bridge between formal surgery and external treatments only. It really gives you that third middle option that is absolutely more powerful than anything external, but also maybe a better option in some cases than an actual incisional surgery.
For sure, yeah. So if you consider external, like laser treatments or all these thermage,
filler, Botox,
everything that we do in different areas, and then you have, before we never had a middle option, something that doesn't require you to go to the operating room to have, general anesthesia, to have a serious surgery or more formal surgery. This is a true middle option. BodyTite offered that to us with body contouring. FaceTite offered that to us specifically for the neck. And now AccuTite does it for areas that we never thought were possible. So we'll go through those areas today and talk about that.
One quick side note.
Yeah.
If people want to see what we're talking about in more detail, you can look at our YouTube channel, but also look on our Instagram feed because we did an unboxing last week of this device. So it is a saved story. So if you go to our highlight reel at the top of our wall, you'll see a picture of it. And this is actually a first for us. This is the first time we're talking about one of these devices and actually able to show it without us just having to describe it to each other like some twisted game of charades.
Which we did last time with the BodyTite handpiece. So we're going to, if you, again, look on the YouTube channel or look on our Instagram, JSmartinMD, to see what these things look like. So the main part about AccuTite, about this handpiece, is the accuracy of it. It's extremely small. It's basically half the size of a FaceTite handpiece. The actual tip of it is 6 to 8 centimeters. I can't remember which one. 6 centimeters long. And it works, in a really interesting way. It's called Bipolar Radiofrequency Technology, or Radiofrequency Assisted Lipolysis is really the more formal name.
RFAL, you mean?
RFAL. So, obviously with anything related to medicine and science, we have to make complicated words and make ourselves sound important. But RFAL technology is really interesting. It is a way to administer radiofrequency energy underneath the skin. It leads to heat creation. We'll go through that, and ultimately leads to tightening of the skin. and also reducing or obliterating fat that you don't want.
And you don't have, the really cool thing about this that's different than some of the other technologies is that you don't need fat in the area where you're treating it. So if you're doing like body tight, yes, it does tighten the skin, but if you don't have any fat there, because you're treating such a large area, it would be problematic if you couldn't at least aspirate out that coagulant. Whereas with this, you're treating such tiny, precise areas. There's not a necessity to have the aspiration component afterward.
Right.
Which is actually, to me, I thought like one of the coolest things. Like when I was setting up for this case the first time, I'm like, well,
I know. We just did our first.
Clamps?
We did our first case today, and I walked in because you set up all the cases, and there was literally no instruments there. I was like, "What is going on?" And it's basically a quick treatment.
Yeah.
And that's one of the things. There's a couple take-home messages of this device, of this handpiece. Probably the biggest thing is just to reinforce with everyone listening and watching. It's done in the office with you awake, and it's extremely quick. We did lower eyelids today in about 20 minutes.
Oh, we could have done it way faster.
Yeah, and we were kind of taking our time because it's a new device. We're kind of using it, so it's pretty remarkable. It literally fits in the palm of your hand.
Yeah, it's like I mean, for people who understand like needle gauge sizes, it's actually a little bit smaller than an 18 gauge needle.
Which is what you would get for an IV.
Yeah, or like a piercing, like we'll pierce ears with an 18 gauge needle. So people who understand that size it's a, pretty decent sized needle, but not huge, but it's actually smaller. It's actually, the tip of it is a finer diameter than even that. I'd say it's probably closer actually to like maybe a 20 gauge.
Right.
So it's very, very tiny. So that's part of the reason why there were no instruments on the field for Dr. Martin, because all he needed to start this case was a 18 gauge needle.
Yeah, you make a small,
just a little poke
into the skin, and you can introduce the catheter and do the treatment.
Yeah,
all right.
So little.
So let's go through it. So in terms of the treatment, so again, radio-frequency assisted lipolysis. What we do, to reiterate, we send energy from underneath the skin, okay, through a small cannula that looks like an 18 gauge needle or like an IV that you would put in your arm if you need hydration. It goes through the soft tissue. It runs energy through the soft tissue, through the skin, and to the outside. That's the bipolar part. The energy is flowing through a current underneath the skin, through the soft tissue, to the external skin and back around, creating a circuit.
And it's hot. Like, I think that's important for people to understand too. Radio frequency historically was very uncomfortable to use on people that were awake because it was kind of unwieldy, but this is so precise, like really where your cannula tip is, because it's so little, like you are directly putting that energy like right there. Like,
right.
So it puts heat in, but it's really fast.
And historically, we've had other devices that treat in a similar fashion in some way. There was something called Thermi RF, but that was unipolar, and that was a lot more uncomfortable. Bipolar radio frequency technology is a lot more well tolerated by patients or by people undergoing the treatment. The second part of this is when the energy, the radio frequency energy, runs from underneath your skin through the soft tissue, which is either fat or which usually fat and skin, it meets resistance. Resistance creates heat, and it's that heat that causes contraction of the skin, causes stimulation of collagen production, causes the fat to be reduced or obliterated. That's where you get your full effect.
Yeah, and really the benefit of that too comes even more so during the healing process. So as all of that, you put all that heat in, you give the skin all that energy, and we may do an external treatment on top of it to even kind of do that a little bit more at the surface to kind of get a little more surface heat in after you put all that heat in underneath. But as it heals, it gives your body a chance to kind of remodel itself, to its new shape, to the reduced fat in there in cases where we're using it to take fat out. But even without that, like, it kind of has to rebuild and grow. And to do that, you need collagen, you need these fibroblasts, you need those factors to kind of make that area heal.
And we've talked about a lot of these topics before. You go back and look at different episodes listen to different episodes on our podcast, you'll see where we've talked about, how damage or heat control damage does cause collagen production and, allows for skin tightening and for improvement in contour in different areas of your body with this kind of technology. But so bipolar radio frequency technology, radio frequency assisted lipolysis, is really the next step in treatments that you can do in the office. And this is why this is groundbreaking. Imagine all these areas that especially in my practice, I do a lot of facial aesthetic surgery. Imagine facelifts, neck lifts, eyelids, brow lifts. Imagine you can get a middle option that takes, a fourth of the time that a regular surgery would take, or
Yeah, and you're awake.
A fifth of the time, and you're totally awake. You walk in, walk out, just a little local anesthesia, a lot less recovery, a lot less bruising, a lot less swelling, and really pretty amazing results. This is great. So options are always great for anyone considering a change and transformation. And this device, this kind of handpiece, really just opens up more options for our patients, which we're really excited about. So let's kind of go through the treatment real quick, if you don't mind.
Yeah.
So
my slides are gone.
Yeah, that's right.
We'll just stay on this.
Yeah, that's good. So let's talk about the areas that we know we can treat. And remember, this device was sent to us last week, right?
Yes.
So all the reputable surgeons in the United States really haven't had a chance to work through its technology. There will be more areas that will be treatable in the future, but let's kind of go through the areas that we know for sure that we can treat right now.
Yeah, so the really novel areas that I'm really excited about are things like the lower eyelids, the brow. You know, right now to have a brow lift is a great option for women and men because it gives a nice brightening effect to the face, but it does include a scar, which some people don't maybe have hair to cover that, or they just don't want
especially
that
men
scar.
with the receding hairlines.
And, you know, so it really gives a great option to treat that kind of that brow area.
Especially the brow on the outside, what we call the lateral side. That's a big,
toward that,
yeah, big
that
change.
outer area. The mid face, which is something that we could not treat with FaceTite because of the size, the angle would be weird. But the kind of that mid face, still the jowls, still parts of the neck, lower eyelids, the hands. I'm really excited about that.
So the back of your hands, especially for Caucasian women as they age, is really a problem area. And you'll see the back of the hands. You don't have a lot of options. I mean, we've done fat transfer and filler injections, but now we can use this device in a very localized fashion to tighten the skin and then do some other treatments on top of that. Maybe fat transfer at the same time or a delayed fashion.
Smooth
right,
it
and some fillers.
Yeah.
The bra line, specifically in the front, which we call, what is the layperson term? I call it the tail of Spence.
I mean, bra fat. Like,
bra
it's
fat.
that fat you can kind of pinch if you pinch above
right near your
breast.
armpit.
Yeah.
Yeah.
That hangs over a bra. And yes, we could in the past liposuction that, but it was really, this device, because of its small size, it really puts that heat right where we want it instead of having to, you know, if you kind of imagine something that's like so small, like the size of almost a toothpick in length, like you can just really get it really localized on that area right in there.
Yeah.
Same thing with like the knees. And depending on the size of a person.
And the elbows.
Yeah, any of that.
So the knees have always been a problem. We've never had options for treatment on that. You and I have tried multiple different things, and this device allows us to treat the knees. I mean, for anyone listening to this who has aging problems with their knees, they know right away and they hate it. And there's really not been a lot of options. The knees are great, especially the upper part of the knees where it meets your thigh. The elbows are always a problem, it seems like, and you can now treat the elbows. The inner thighs, which we could treat before with FaceTite and BodyTite, but now we can treat it more focally with this handpiece.
Yeah, to get that heat closer to where we're starting from. And I think that was always kind of the problem with all these technologies, because when you're thinking about any type of assisted technology for liposuction, they're all basically using heat of some sort. So whether it was energy, I guess is the better word for it. But because of that, you know, you have to stay a little distance away from where you're starting. So you could never really get really close to your port site.
Right.
You know, and on some people that doesn't matter because you still get that kind of effect overall. But when we're talking about these little tiny areas like that little bit of bra fat, like the very top of the inner thighs, the knees, like you kind of need that heat all the way to the end of where you're treating, or else you're not going to get the full benefit of the treatment.
Right.
So like that really, and same thing with the elbow. Like it would be so hard to get the BodyTite cannula into the elbow.
Or any kind of device. It doesn't have to, I mean, you could just
can you imagine treating
go
that
outside
with
the
smart lipo?
InMode world, trying to do a smart lipo in that,
really
or
scary.
Vaser, even things like Renuvion, some other types of technology. This thing is so small, there is really nothing comparable on the market right now, besides maybe Thermi RF, and that's unipolar and just really not useful. But so, you know, this really transforms the game and lets us treat smaller areas. Other areas which are not indicated at this point, but probably will be, are definitely labia, your labia, or even your calves, even people near the ankles.
I was saying around the ankle, like where you get that kind of aging fat and the mons. I mean, that was where I was. The labia kind of freaked me out just because.
Right, but it's going to be.
I'm 100%. Sure there will be doctors doing that.
No, 100%. That's going to be indicated and cleared. So the labia, the mons, and if you imagine that we're doing this stuff internally, so we're administering this radio frequency energy. Imagine also that now we're going to treat also externally with, in the case of M-mode, it's going to be Fractura or Morpheus, and sandwich in that skin and soft tissue with even more energy. So now we're taking something that had better results than most other things in the market, and we're going to even potentiate the effects, make them better with adding even more energy externally. And that's going to be very common in almost all the places we treat. So I don't know. I think it's really cool. Now, let's kind of go through what people can expect if they're going to do an AccuTite treatment on the day of surgery.
So day of surgery is going to be very similar to any other in-office procedure. You're going to come in, probably have your pictures taken if you haven't, make sure your consent signed, all that kind of good stuff, mark the areas of treatment, and then have them, in the case of AccuTite, it's a little bit different. A lot of these areas are so small that we don't need to use a tumescent solution. We can just locally numb them because they are so little.
Like, so for example, we did a case today. We did the lower eyelids. The patient came in, I marked her. We talked about the risk and benefits. She signed a consent form. That took about 10 or 15 minutes. We both agreed that I was going to do the surgery, and we took her back to the procedure room, and we disinjected her lower eyelids, the soft tissue, the skin and a little bit of the muscle, with a standard local anesthetic solution that you would get at the dentist.
Yeah, just like we'd do for any other in-office procedure, like a blepharoplasty. It's
Right.
pretty concentrated, so she was very, very numb.
Yeah.
Like we didn't have to dilute it because we're treating such a small area, so it's really, really strong. Like she was totally numb. Like
It took about 15 minutes to inject because I inject really slowly, so it's a little bit more tolerable for the patient. Then we went to the treatment room. We laid her down. We prepped everything out with some sterile paint and put some towels around there and did the treatment. The treatment itself, as I said before, it takes 20 minutes for both eyelids, 25 minutes at the most. And we were taking our time today, just kind of fooling around with it.
I mean, you could have done that in 10 minutes,
Yeah, 10
start
minutes.
to finish.
Let's say 10 minutes.
Yeah. Really
See,
could
you
have.
always say I'm the one
know.
that says I do things so quickly,
No.
and it's actually not as quick as I'm saying I'm doing it, but no.
No, this you actually could have done. I have no doubt you could have done both sides in 10 minutes.
It was pretty
easily.
remarkable.
Yep. Because it is just so accurate. It's not like you need, like, you're not working through really thick, dense tissue, so it doesn't take a lot of time.
Right.
Like to heat that up.
So I took, as we said before, an 18 gauge needle. They talk about a 21 gauge needle. We took an 18 gauge needle, made a little poke in the skin, and then you take the small cannula. Again, if you're watching on a video, look at Instagram, you'll see the small little filament that goes underneath the skin. And kind of just snake that through underneath the skin, especially on the lower eyelids where the skin and muscle meet. I was kind of in between that plane, and treated multiple areas that she was having problems. And you could see the change on the table. That's what was remarkable.
It was instant.
You could see the skin almost shrink wrap down. And then after I did the skin, I treated a little bit of the fat of the lower eyelid. You have to be careful with that because of some of the other anatomy in that area, and I treated that fat. And once I did that, the eyelid got even better. It was truly remarkable.
It really was. And she was interesting because she really only had fat on the left side.
Right.
But it made her look a little asymmetrical when you look straight at her, and it'll be interesting to see as that, heals, if that symmetry has resolved her. I mean, it's very possible she has some type of just underlying. She had the fat there, obviously, but maybe her bone is just a little different there. Like it still might be a little asymmetrical. We all are, but
Right.
It was really cool. I mean, the difference side to side during that was pretty remarkable.
So with this device, you set an internal temperature and an external temperature. That's how you ensure the safety. So anything that creates heat, what's the one thing we worry about, Amy?
Burns.
So this device has safety mechanisms built in. It's not only measuring the temperature on the inside, but also on the outside. Dr. Chris Chio is one of the kind of pioneers of this technology, referred to it as dual zone temperature control, which I thought was...
It's like a car.
Yeah.
Passenger driver.
Right. So you can imagine the inside of the skin or underneath the skin and the outside, you're going to measure the temperature the whole time. That ability to measure it really ensures that you're not going to have some unwanted outcome or reduces the risk of an unwanted outcome, specifically a burn. It also allows us to know that we're doing what we need to do. Measuring that temperature allows us to figure out that we're getting the right temperature inside to have the wanted changes that we want, which is more collagen production, reduction of fat, all the things that would make the outcome better. And also this device has the special ability, which they call a TSP, or temperature surge protection. If the temperature does jump really quickly, the device will actually shut down. So that's called a TSP.
Well, it doesn't shut down. It just shuts the energy off.
All right.
It's not like all system fail.
To me, it's shutting down because it stops working.
It
right?
just turns the
It
energy
takes a
off.
second. I have to wait
Yeah.
for a second, which I'm not
You
patient
just have to
sometimes.
take your foot off the pedal
Yeah.
to reset it.
So these safety mechanisms really make this safe. So, for example, in the case today when we were doing it, again, Amy was right. Probably could have done the whole case in 15 minutes, literally. I would treat different areas, and I could watch the heat profile change, and I know that I'm getting good energy in there. And once I got to the temperature levels that I wanted, I moved on to the next area. So that was good. You can not only feel the change, but you can visibly see the change. And especially with this, because it's so accurate and so superficial and so localized, you can almost like see the change immediately when you start using it. And you don't have to treat an area for a long period of time. So I can't imagine any of these cases with AccuTite taking more than an hour, no matter how many areas you did. I mean, I guess you could do theoretically a lot of areas, but I mean, because you could.
You could.
Yeah.
That's going to be time consuming just because that's what takes time with a procedure, is prepping.
But I would
draping
think the standard
and,
patient is probably less than an hour for any, even if they're treating multiple areas.
Most likely, yeah.
Since we use the 18 gauge needle, there is no sutures. The small little stab that we made in the skin, the small little hole we poked, that will heal up. And just like if you've ever had an IV or had your blood drawn, you won't see a scar there. There will be nothing visible left.
They don't need to suture that out after you do a VP.
Another thing we noticed from this case today is that there's there's a huge reduction in bruising and swelling. Because this device is heating up this area, it's also causing coagulation. And actually, that's one of the things they talk about from a science standpoint, coagulation necrosis with this type of radiofrequency technology. That's also working on the small little teeny blood vessels there that want to bruise and bleed. So anyone listening to this who's had Botox and fillers around the eyes, they probably bruised. And
at some point, it's inevitable.
It's inevitable. And this device, actually today, this lady had minimal bruising. I mean, not much at all.
No, really, really minimal. And I don't think she'll have as much as it may have appeared on the table. She'll use some arnica around that area for a few days topically, and I expect that she will have extremely minimal bruising. And that's also the great part about being able to do really strong local, is that it has a really high percentage of epinephrine in it too. So like that additionally helps.
That's a good point.
Like she wasn't, there's no bleeding. It's like.
Yeah, with the body type procedures, we do bigger areas, so there's not as much epinephrine. Epinephrine causes the blood vessels to constrict or clamp down, so you don't get as much bruising and swelling.
So all in all, I mean, it was a very simple procedure to do, and I think she's going to be really happy with her outcome. She has premature aging around her eyes, which a lot of people do, but even people who have normal aging around their eyes, it's still aging.
Right.
So the things that bothered her, could be addressed somewhat with Botox. There were some other things that she could continue to do, but this hopefully for her will be a much more longer lasting procedure, so she's maybe not needing to do Botox every 3 months.
So if you think about areas that are small, so imagine your palm and areas smaller than the size of your palm. Okay, imagine those are the areas that are problems. The back of your hands.
Something like just 2 fingers
or
is
even
kind of
2
what
fingers,
they show as like your areas.
2 fingers, like the eyebrows, the outside of your eyebrows, the lower eyelids, the upper eyelids, your jowls. Okay, that jowls is the kind of aging contour changes that happens on your jawline that makes people look older. Your nasolabial folds, those are the things we always get injected with Juvederm. It goes down from the edge of your nose, your ala, to the edge of your mouth. The opportunities are endless, and this is what's so funny about this device. You could just keep on talking about the areas we could treat, start making those up. Just small areas is like anything with loose skin and a little bit of fat that you don't like.
And in the past, obviously we all have those little areas, and like sometimes there legitimately was like not an option that was really a feasible option for people.
And there's always an option with surgery in most cases, but most people don't want to do surgery, and that's the in-office awake procedures are the future for plastic surgery and aesthetic medicine. So, and plastic surgeons don't always want to admit that because it relegates us to like dinosaurs a little bit. But to all the plastic surgeons listening out there, it's okay to change a little bit and do these cases in the office. Most people that come into our office would consider a middle option, even if it doesn't have the power of the surgery. They would consider it. I'm not saying they would do it, but they would consider it.
Mm-hmm.
It's something that would come into the decision-making process. And I bet you a higher majority than we think would choose the less invasive option, even though that they would only get maybe 60% of a surgery result, or best case scenario, 70%. I mean, it's person dependent.
It is.
Yeah.
And it depends on the person. I mean, this is a great option. It's not going to be the option for everyone. If you are, as any of these devices, even, not so much body type, but face type, all of them. I mean, if you're past the point of where you need surgery, it's not a good option. It's not going to really serve you to spend the money on doing something that's really not going to fix what's going on. Like if you have a extremely loose neck and all the, the fat in your face is completely descended, nothing but a face and neck lift is going to really fix that. If you have skin that's hanging over your pants, nothing but surgery is going to take that away. But what's so cool about this is that for people who legitimately had little tiny things that, what do? You're going to do a brachioplasty on somebody who has a little bit of armpit fat? Like, no.
Oh, that's another one. We forgot about that one. The upper arms.
Yeah.
Near your armpit. Some people just have a little bit of fat in the skin right in the upper third of the upper arm.
Yep.
And this AccuTite would be great for that.
And a lot of these people, it's not even so much fat. Like it's, when your arm is down, and most women will probably know this, like it's the area in between the muscles where there's just not a lot of structure to hold that skin tight. And as you age, it starts to get this weird kind of loose, stringy look right there when your arm's straight down. So like the rest of your arm may look great and your muscles may be toned, but you have this weird little patch of skin that's not really attached to anything because it's in that junction that starts to look really weird. And there was never a great option for that before. Even a brachioplasty wouldn't really fix that.
You got to come up with the slang name for these areas.
I
like
know.
Tummy tuck, mommy makeover. You got to have something for that weird area of the arm that women don't like.
I know. And all women, and they're like, they try and like explain it to me. And I'm like, oh, I know.
Yeah.
So if you have it,
Yeah.
Help me figure out a name for it.
I know. Weird arm area.
Yes.
So that's good. And then again, since in-office cases have a much lower incidence of infection, no matter what anyone tells you, they have a much lower complication rate. That's absolutely proven. There's data out there. I mean, there's articles I've read from Germany and America that show that. And they have, in almost all cases, a shorter recovery. So there's just purely from a facilitation standpoint and doing the surgery, it makes a lot of sense. Mm-hmm. It reduces cost. There is a cost related to anesthesiologists in using OR space. Like you can't get around that. So just taking that out alone alleviates some of the cost burden to you as a patient or for you considering this procedure. Now, technology costs money. We're not here trying to promote InMode. We like InMode, but we're not promoting InMode. So they make money off these handpieces, and these handpieces actually cost money. So
yes, they are disposable.
Yeah, and most doctors are probably going to pass that cost on to you. So there's an elevated cost just with these procedures alone because these handpieces
paying for the technology.
Paying for the technology.
Yeah.
And these devices themselves cost a lot of money. But it's a truly remarkable advancement. I like anything that's miniature. And I like the fact that it keeps getting smaller and smaller. The next one's going to be the size of my thumb. And
well, how big is put your thumb up there.
Okay.
I mean,
we're looking at it now.
Like it already is the size of your thumb.
All right, put this up in the air. There.
In the air.
In the air, yeah. So I don't know how much smaller we can go than this.
It can't go much smaller.
Yeah.
This is like bordering on, what was that movie with the tiny, tiny phone?
The next one, I told you, Blue Steel, yeah.
Zoolander.
Yeah, Zoolander.
The phone that was like so tiny.
I don't know what you would treat at that point. Maybe the earlobes.
I was actually thinking that this would be great for redundancy anterior to the ear.
Right.
Yes, and even like maybe
we should do a contest for everyone who listens to this podcast. Just write into us an area you think could be treated with an AccuTite handpiece that hasn't been mentioned on this podcast.
Yes or no? One area that we haven't discussed that would be interesting is, women want like an upper lip lift.
Oh, that's a really good one.
Pull the lip up a little bit.
For sure.
Because this is thinner than, this is the size of a needle that you almost use to inject filler.
Because with those upper lip lifts, you put the incision underneath, like
that
at the
weird
base
scar.
of your nose. Yeah, which looks terrible.
Yeah,
that's a really good point.
You've got a rhinoplasty.
Yeah.
But like if you could get that lip to elevate just a tiny bit, and so precise, like this is the same size as the
another
needle.
thing too, actually, is we inject Botox into, what do they call them? The rabbit lines?
Yeah, bunny lines.
Bunny lines? Sorry, rabbit.
Bunny lines.
It was close.
It's like, yeah.
All those terms I always mess up.
Because you don't have them.
Okay. So you could actually use this and actually treat the muscle there and almost knock the muscle out.
The bunny line?
Yeah.
That sinus?
There's so many different things that we could do here with this.
The great part is, too, is it's a good add-on. So even if you are having an OR surgery, a lot of times something like the lower eyelids, maybe a woman or a man has had a lower eyelid surgery before, and we really can't take out more skin. Like, that's not an option without maybe risking making their eyes look a little bit odd.
Mm-hmm.
If we're doing a facelift anyway, like taking this and doing it at the same time, or, if you're having a brachioplasty, doing it in the front of the arm to really address that at the same time. So adding this on to formal surgery is also a really great option.
Yeah, totally agree.
I agree. I think we should have a contest.
A contest, see what we can treat.
Send us your AccuTite areas.
Okay, so in summary, first and foremost, this is done in the office with you awake. It treats small areas of your body that have loose skin and fat, usually related to aging, but you can be younger and have issues in these areas. And so areas that we normally couldn't treat before, we can now treat with this technology, which is radiofrequency technology, bipolar radio-frequency assisted lipolysis. That's what they call it, which basically just means that we make a small poke in your skin. We put a little filament underneath. I don't know a layperson term for what this underneath the skin thing would be called. A small cannula. Filament.
Yeah.
Filament. The size of an IV. Imagine what an IV looks like. And that delivers radio frequency energy underneath your skin. Then it flows through your soft tissue in your skin to the outside. It comes back to the machine, and that's the bipolar part. It creates a circuit. When the energy flows through, it creates heat. Heat is where you get the effect. Causes damage. Damage brings in fibroblasts. Fibroblasts makes collagen. We also destroy fat you don't want, so it's a win-win for everyone involved. These procedures, this handpiece, the AccuTite handpiece, is very accurate. It's about when we did this procedure today, it got right to work. There was no wasting time.
No, It is pinpoint accurate.
Ready to go.
Yes.
Okay, and the small area we treat it within literally 10 minutes. So I don't know what else to say, but this is pretty awesome, and I think the future is very, very bright, specifically for this handpiece. And probably the biggest reason, just for my professional opinion, again, not trying to push InMode too much, but is that there's really no comparison on the market right now. So, easy in, easy out, short recovery, and that's really good. I do think it's important, though. When I was using this handpiece today, from a technical standpoint, it was not super easy. So I would highly advise people listening to this podcast, if you're going to seek out this technology, preferably from my standpoint, make sure they're a board certified plastic surgeon. At the very least, make sure they've had experience with BodyTite and FaceTite.
Yep. Or an oculoplastic would be.
Yeah, ophthalmologist, ENT surgeon,
somebody who understands the anatomy of the
oral
face.
maxillofacial surgeon, especially because most of these treatments are going to be on the face. So make sure you seek out someone with the expertise if you're doing facial procedures. If you're talking about the body stuff, I think that you could be a little bit more, maybe not lackadaisical is not the right word, but a little bit more forgiving if they're not maybe a board-certified plastic surgeon. What else? Anything else? Oh, wait, I didn't have you describe the handpiece.
Oh my goodness, we're playing our twisted medical charades game.
If you go back in our episode on BodyTite, we tried to describe the handpiece, and it was an epic fail. If you look on our YouTube video, you can see the handpiece. It has the green coloration that I said was like Tupperware from the 70s.
Which it is. It is very much Tupperware from the 70s.
Yep. This handpiece, unlike the BodyTite, has the green color Tupperware from the handpiece, but then it has the filament, which is like an 18-gauge needle, but smaller. And then it has this white spanning part that's flexible. I mean, this is impossible.
That's harder to explain.
I know.
Yep. It is harder to explain.
It has a little Lego look to it almost.
Well, it almost looks like a little like if you had toothpicks that you were using as chopsticks.
Yeah,
like
it has
that.
a chopstick feel to it. Yeah.
Yep, like a little tiny like.
There you go.
Yeah, like a toothpick chopstick.
It's like a skin tightening chopstick.
Yes, it is. Yeah.
That's a good one. I'm gonna use that one actually in consults.
This can be part of your iron surgeon discussion.
Or we could do a contest for people to describe the AccuTite handpiece in one sentence. We could do that one too. Yeah.
It's gonna be. I mean, you can describe it, but if you
There's
understand
gonna be so many
it,
people
that's
writing
different.
us nils. I don't know what we're gonna do.
We're
with
gonna be
ourselves.
bombarded. Yes.
Okay. That's really it. We are really excited about this device. The jury's still out on a lot of these areas, so we don't want to oversell what we're doing. It's just being released. There's only probably 3 or 4 practices in the country that have this device right now, and we're one of them. We happen to be a training facility for some of this technology here in the Mountain West region, which is basically everything besides California, Washington State, and Oregon. So we get these devices first because we get to try them out, help them with the protocols, more importantly, help with safety and training. We're very excited about it. If you're interested in this, we're going to have a microsite up called Denver AccuTite, DENVER, AccuTite, AccuTite. That's going to be up on the interweb, and there's a .com at the end of that because you need to add that, don't you, Amy?
Well, you still find it without it, but that'll take you directly to it.
Just joking with you. So yeah, Denver AccuTite, which will give you a lot of information. There's a virtual console in there. And you can try and see if you're a candidate for this. There'll also be some videos of us talking about this technology.
I think that's it.
Tiny but mighty. What are all the slogans before we go for this device? The marketing team for InMode.
Precision and accurate, small.
Precision, accurate,
precise.
Tiny but mighty, precise.
Accurate, precise. Say buzzy words.
Yeah.
More small things.
Yeah, I know. And just like Yoda, you may look at it and don't think it's going to kick your ass, but this thing can really, in a small way, kick your ass.
It doesn't mess
or kick your
around.
eyelids.
Kick your eyelids. All right, I think that does it. So thank you all so much for listening. Please do leave us a comment, like us, rate us and review us, share us with your friends. It does help so much, and we'd love to hear your feedback. Follow us on Jason Martin, MD. We're also at Beauty and the Surgeon Podcast on Instagram and YouTube at Jason Martin, MD as well.
Thank you so much.